Yo, 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 what is the deal? What is the deal? How are we doing? How are we doing? We are not doing questions today. We are doing essentially just like an AMA. I'm kind of sitting outside, kind of chilling. I'm sitting outside. I'm kind of chilling right now. Had some other things I needed to do today, so didn't have the time to getting any questions. So just wanted to see what everybody had going on, what questions you guys have. We're doing essentially an Ask Me Anything, talking about nursing stuff. So if you guys are just joining, my name's Kevin. We're essentially doing an Ask Me Anything, not doing any NCLEX questions today. So I know people are going to be real disappointed. So I may not have a really good turnout, but that's okay. So what I do want to know is who you are, where you're from, where you're at in your nursing journey, and what questions do you guys have about, nursing school, getting into nursing school, being a nurse, your first year of nursing, what questions you guys have, so on and so forth. Demi, what's up? How are you? Hola, hola, hola. Happy Wednesday to everybody. Hope everybody's been having a good week. So what you got for me? Montego Bay? Man, look, you always in here. I love it. Shout out to Jamaica. Shout out to Jamaica. You rocking? That's what I'm talking about. Hey, so if you guys are just joining, we are doing an Ask Me Anything. Of course, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. We do NCLEX questions throughout the week. We're just not doing them today, doing something a little bit different. So whatever questions you guys have, you guys can drop them in there. I'm outside, and my son is like right here by the window, so he sees me, so he wants to come out here and act a fool. But I can't stream and then try to take care of him because you're going to hear him screaming, and then, he wild. Like right now, he in the window, acting like he ain't got no sense, like he got no home training, like he's been raised in a barn. But his mama in there handling him, so you know how that goes. Anyways, what questions do you guys have? I want to know who you are, where you're from, where you are at in your nursing journey, so on and so forth, right? Make sure you guys smash that like button and make sure you guys follow. Don't be greedy your whole life. How many attempts did you take to pass NCLEX? For me, it took me 4 attempts. So I failed on my third 3 times. 3 times, not 2 times, but 3 times I failed, and then I passed on my 4th time, and it was during COVID. So they got rid of the research questions. They actually cut the testing time down as well as the questions. So I passed my NCLEX with 60 questions. And if you don't know this, is like 15 of those questions that are on NCLEX are research questions. So you don't get graded on those questions. Those questions are used for future tests and when they do revamps and all that other good jazz. So that was a good question. What else you guys got? If you guys are in here, welcome. We are essentially doing an AMA, like an Ask Me Anything type deal. So, specifically about nursing, you get personal. I'm going to get personal with you. You know what I'm saying? I'm just playing. We ain't going to do all that. But, ask me stuff about nursing. I want to know who you are, where you're from, where you're at in your nursing journey, what questions you guys have. Do you have to become an MP to obtain your doctorate? No, you do not. You can go in different directions to get your doctorate. You can become, a doctorate and get your doctorate in nursing education. You can get your a doctorate in nursing practice. You can get your PhD. There's so many different ways. I don't care to get my MP. Who said that? I don't care to get my MP. You don't have to get. So you're being a nurse practitioner. Those are usually those are master degree levels of nursing. Okay. So they do have programs to where you can go and get your DNP as a nurse practitioner, but you don't have, like, most nurse practitioner programs are master level programs. So, but hey, so shout out to all 41 of y'all in here listening to me run my mouth. Hey, we're essentially doing an Ask Me Anything in regards to nursing. Nursing, NCLEX, getting into school, prerequisites, whatever questions you guys have. If you guys are just joining, that's exactly what we're doing. So what's up, Happy Mom? How are you? I ain't seen you in a minute. I've been out there studying, I hope. So hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Taylor says, what do you recommend for studying for NCLEX? I am a repeat test taker and I did Archer first round. So Taylor, what I'm going to say to you is that there are a lot of reviews that are out there that are really great, but it all boils down to you. Like, what is it that you don't understand? Like, do you have an issue with content? Do you have an issue with understanding NCLEX style questions? Do you have environmental issues? Environmental issues, like, what distractions do you have? Do you have badass kids running around? Do you not recreate the testing center? And this is coming from a repeat test taker. I've taken my NCLEX. I took the NCLEX 4 times. And so these are all things that I had to audit for myself in order for me to do better. So I think Archer's great. They have a lot of things that they offer for not a crazy price. They have so many different things available. So one thing I would say is to definitely look within yourself to see, what type of reviews could work for you. I coached a young lady yesterday who used Mark Klimick, who personally used Mark Klimick and still wasn't able to pass her exam, right? So it all boils down to you, 100%. So there's so many I can recommend, but in the end, it's all up to you. Okay. Is it Emmeline? Emmeline says, how accurate is the good pop-up on the Pearson View trick? So Emmeline, I'm glad you asked. So here's the one thing I'll say. The Pearson View trick is unofficial. It is a unofficial glitch in the Pearson View system, right? I've seen people get the good pop-up and fail. I've seen people get the bad pop-up and pass. So when you do the Pearson View trick, even though I've created videos and stuff like that, you are doing that at your own risk. It's probably about 99 or 96%, whatever, however you want to call it. Once again, like I said, it's a glitch in the system. So, you will do that at your leisure, and if you get the good pop up and you fail, you can't say I didn't tell you so. You know what I mean? How do you study med-surg? In med-surg, I would recommend getting into a small group of people, 3 other people, spreading it out 25%. Breaking the chapters up, doing whatever that you need to do in regards to that, and then doing 25% of work and then reaping 100% of the benefits. I'm good. Yes, this semester is almost over. I know that's right. Everybody getting ready for the holidays. So skin is broke out, but I'm going for it. I know that's right. Go make it happen. Do I work in a hospital? I do. Currently right now I am on short-term disability because I got hurt. I fell at work. But I do work at a hospital. Can I use any of my 20 years of a paramedic training to go? Absolutely. With your 20 years of being a paramedic, like the hands-on aspects of nursing school are going to be people will flock to you because you have so much hands-on. Trust me, like as a corpsman, as a surgical tech, been deployed twice. When I started doing the hands-on stuff, a lot of the nursing students were just like, wow, that's great. Like, I want to hang out with you because you know how to do the hands-on stuff to make me feel comfortable. Jay Matta says, I'm an ER nurse. Shout out to you, ma'am. Emma, took my NCLEX pop-up. Took my NCLEX yesterday, got the good pop-up on Pearson View, but don't know how accurate it is. Well, I just told you that, so there's that. I've done Mark Klimick and Archer and Mark Klimick and still no luck. So once again, this boils down to you. It boils down to you. Some with the pop-up, it's a glitch. Yep. Do you know anything about Capella Flex path for BSN? I do not. You can definitely educate us, though. Emmeline, you are very welcome. What job do you have as a nurse? I'm an OR nurse. I've worked in the ICU. I've worked in 3 different ICUs. I've worked in the PACU or the recovery room, and I've worked in the OR. So currently I am a surgical tech. I am a scrub/circulating nurse. My instructor said the good pop-up is about 75% accurate. I mean, like I said, it's not accurate. Like until you see a license or you get that quick or the quick results from Pearson View. I mean, like I said, you are doing that at your own risk. Yep, you can. You're welcome. What's entry level ADN pay in California? I wish I could tell you because I don't live in California. You might want to ask somebody, or a quick Google search of salary.com. But I think entry level for California is like $40. I think. I know my girls are looking only for 8 and UNC Amen. I don't know what that means. I love Archer. Mark Klimick, currently a dialysis nurse. Hey, Archer's great. Mark Klimick's great. Like I said, it all just depends on you and what you need to do for yourself in regard, because I could literally walk you step by step on how to understand questions, understand content, what reviews to do, put you on all these different things. But if you don't do it and put forth the effort, it won't happen. I'm not taking the test for you. I got my license. I had to figure that out, right? So you have to really determine and audit yourself on what you need to do for yourself. So shout out to everybody that's following. How's the OR? I think the OR is pretty great. You get 1 patient at a time. You have a surgeon, anesthesia, you have a tech, you have you. There's always going to be a minimum of 4 people that are in there. I don't think it's a bad thing at all. Big Mike says, I know you may not think it's real nursing, but I started LPN school next month. Mike, what are you talking about? You must be new here, bro. You really must be new here, because I give nothing but love to my LPNs. Okay, so I'll give you an example. I'm a corpsman in the Navy. A corpsman in the Navy is equivalent to an LPN. So I've been an LPN. I was an LPN for a very long time, became a surgical tech, and that's what I was doing. And then I became an RN. So I don't, like, this is not one of those channels that shits on LPNs. Like, I love LPNs. Shout out to all of them. Shout out to everybody that is in ancillary services, occupational therapy, patient care tech, CNAs, all of y'all. Like, I don't shit on people like that. If you come in here with an attitude though, thinking that you're better because you're an LPN or whatever, then that's when I'll check you. But we don't do that around here. We don't do that around here, bro. None whatsoever. Advice for someone considering nursing school. Do your research. Was it facials and lashes? First of all, look. I don't need no lashes, but the facial I could do, you know what I'm saying? But my advice for you is to really consider if that's what you want to do. Really do some really good research. Do some really good research, facials and lashes, if this is what you want to do, because what is projected to you on commercials and on radio is not the real life of being a nurse. And then you really have to have a passion. You really have to have the passion and the want and the love and the desire of taking care of people. That's what I would definitely tell you. Because, your first year, 2 years of nursing could really fucking suck because of all the things that you're going to go through, learning aspect and, older nurses eating their young, the cliquey mean girls bullshit, administrators, not giving a fuck about you, just a lot of things. But then at the end is like, what is your goal? Do you want to be a nurse practitioner, pediatrics? Do you want to do CRNA? Do you want to do research? Do you want to, open up your own clinic? Do you want to do nursepreneurship? Like there's so many different things that you could do with a license, either with an LPN or an RN. Okay. $40 is what Florida is paying for skilled nurses. Okay. $220,000 for CRNA. Yep. In California, or I don't know what the national median is for CRNAs, but CRNAs, they make that money, but you're going to work for it. You're going to work to get into school. You're going to work to get through school. You're going to put that work in outside of school. You're going to do it. I'm thinking about OR. Go do it. Wait, what I miss? I don't know what you're talking about. Hey, Mike, straight up. We love LPNs. That's what we do around here. Lisette says, just want to say I watched some of your NCLEX questions live and took my NCLEX and passed. That's what I'm talking about, Lisette. That's what I'm talking about, Lisette. What I need for you to do is to send that to me. Send that to me in a DM. As a matter of fact, yeah, I just screenshotted that. Caught in 4K, baby. Anyways, so hey, everybody right now, give Lisette some love. Everybody tell Lisette right now that they're proud of her now that she's a nurse. Hey, what type of nurse are you, Lisette? Congratulations. Welcome to the shit show. Welcome to the shit show of being a nurse. Welcome out here. All right. And I don't know how long it took for you to study or what struggles you went through, but now you have gotten past that finish line of one race and now you're starting another. So congratulations to you. Carrie says, hi there, nurse since 99. Shout out to you. What type of nurse are you in? I'm an OR nurse. Tash says favoritism. Yeah, there's a lot of favoritism that happens, so you definitely got to watch her that. My girlfriend hates trauma. She likes long care. Shout out to your girlfriend too. I'm a nurse. Always wanted to be a nurse. Now I don't want to do it. So Jackie, what I would tell you is like, look outside of, traditional nursing. Look at non-traditional nursing things where you can still use your license, but it doesn't have to necessarily be patient care. Can you recommend any schools from LPN to RN? One of them I can definitely say is, I think it's Western Governors University. I can definitely recommend that. Facials, you're welcome. You guys are smashing these questions. I appreciate it. Hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow, because these questions, these Q&As, they can really help people out. And I'm like 15 of them behind, so I'm answering them. What area of nursing are you in? I'm in the OR. Congratulations, Lisette. Congratulations. Everybody's proud of you, Lisette. Straight up. I just took a job in peds. Go out there and take care of those babies. How do you like the OR? What are the hours? It all just depends on the hospital that you work at. Usually it's an 8 hour, you can work 40 hours, 5 days a week. You can work 10 hours for 4 days a week, or you can work 12, 3 12s. It all just depends on you. It depends on what the OR's needs are, so on and so forth. I've been working in the OR since 2010. I was a surgical tech, then I became a nurse. I did ICU, then I did PACU, and now I work in the OR. So, OR is pretty much, surgeries. The surgical realm has pretty much been like my home for the past, decade and some change. So I'm OR too, but plastics and eyes only. So when I do the OR, I usually work general surgery and GYN. I don't like doing anything else, to be honest, like nothing else. Trauma OR here, and I love it. I know you do. Getting them there and getting them open bellies, getting them AAAs. Girl, I know about it. I'm an EMT going LPN instead of medic. Thank you. Thai waiting list for RN was too long. So Mike, I can tell you right now, hey, at least you're getting your foot in the door. Who knows? You could be an LPN and just love it and not want to go to be RN. And guess what? That's fucking okay. That's okay, bro. I know plenty of people that have been LPNs and that they love it and they don't want to go be an RN. You know what I'm saying? I'm telling you right now, if people are telling you you need to go RN, you tell them to get the fuck out your face, because you don't need to do anything. You do what you want. However, if you do want to excel, throughout the realm of nursing, you might want to go RN, or you might want to go RN and then go MP or go advanced practice nurse, whatever. The world is your oyster in regards to wherever you want to go. All right. I'm going to start my prerequisites in a few months. Did you go straight for your BSN or associates first? Bianca, if I could go back and do it all over again, I would have went straight for my associates, because the associates RN and the BSN RN, you both take the same test. You take the same exact test. But I was active duty in the Navy at that point, and I was trying to get commissioned as an officer. And the only way to get commissioned as an officer in the military is that you have to have a bachelor's degree at a bare minimum. So if I could go back and do it all over again, I would have done the associate's degree. Anna says, I'm in the legal field right now, going back to school for nursing. Any tips for nursing school? Hey, first of all, Anna, if you're in legal, I would think about going to being a legal nurse, because your legal aspects and your knowledge towards nursing and the medical field in general is so just, that's a great combination, especially if you wanted to do legal consulting. My tips for nursing school is to understand, definitely time management. Time management at its fullest. Who is this? It says, hello. Do you think you can be in nursing school and work full-time job? Absolutely. I worked a full-time job. I was active duty in the military. When I went to nursing school, I was also a clinical instructor and a surgical tech instructor while I was in school. So I worked 40, 50, 60 hours a week on top of going to school and clinicals. I had no days off. Legit had no days off. So can you please repeat school name? I said WGU, so Western Governors University. Yep, Western Governors University. What's the significance of the name boot nurse? So it's twofolds. Boot nurse is essentially, the word boot essentially is like a military term for people coming straight out of basic training. You know nothing about nothing. So, and then you know nothing about nothing, but the room and an opportunity for you to grow is always there. So we're always continuously learning, right? And so that's where I say, like, hey, I'm a boot nurse. Like, you hear people say, like, I'm a baby nurse. I don't like the term baby. It feels kind of weird. People still call me a baby nurse or whatever. I was like, well, I'm a boot. So I'm just trying to figure out life right now. Right. So that's the whole premise of where it started. And then, of course, I'm in the military. I have a military uniform, and the boots are very recognizable. So those two things kind of go hand in hand. So that's a good question. A lot of people ask me that all the time, but I don't really go into detail too much about it. But hey, there's the detail for the day. Any tips for NCLEX PN? Study for it. Also, I just want to let everybody know, I have an NCLEX course. 7-day NCLEX course is in its pre-launch phase. It's for $48, y'all. And we're continuously adding content in it. I'm letting you know right now, all 81 of y'all, that course is going to $97 for Black Friday and Cyber Monday. And then after that, it's going to a full course. It's going for a full price. And it's going to a subscription base. So if you get it right now, you get it for a lifetime. I'm just letting y'all know that. So definitely go over there. Check those links out in my bio. Also, if you're looking to do one-on-one, like if you need one-on-one help, coaching type deal, tutoring with me, that link is also in my bio. You guys can go and check that out. Okay. Let's see. It says, true. I was procrastinating about applying for my RN program in 2019. Now I'm all done. I know that's right. You do have to be dedicated for school for sure. Like, that is your whole life. Brittany says, I worked a full job, 2 kids, precepted, and will graduate in December. Anything is possible. Let them know, Brittany. Let them know. Shout out for all y'all for the follows. 7 days, $48. That's cheap. It is cheap. That's because it is a brand new course, but you get everything as it's uploaded. You get everything as it's updated. Like right now, I have my my new generation NCLEX review, just the new generation aspects with questions being being edited right now, and that should be updated. It's a little bit of a delay, but I appreciate everybody that's being patient. That's going up there soon. And now I'm also working on doing the actual 7-day review, which will be breaking down management of care, pharmacological parenteral therapies, reduction in risk, physiological adaptation, all 8 sections of the NCLEX pie. And I'm going through questions, answers, reading rationales, picking out, understanding the topic of the question, and understanding and really applying the content to what you have to learn. There is no tricks, ladies and gentlemen, to passing this NCLEX. There is no tricks. You have to put in the work. You have to put in the work to understand what these questions are asking you. The NCLEX is about critical thinking and clinical judgment. It is not about memorizing. It is not about remembering. It is about analyzing and application. You have to analyze and think about what they are giving you, and you have to apply. You have to apply. Okay. Did they make a what? Did they make a what? Yeah. So the new generation NCLEX, it actually went into effect April 1st of this year. Not a joke, not a game, not an April Fool's joke. How is the LPN questions different from the RN? So the LPN questions are different from an RN because you need to know what the scope of practice is. You as an LPN need to know what you cannot do, what you can and cannot accept. And as an RN, you need to know what you can and can't do and what other people cannot accept. Like LPNs cannot take unstable patients. I don't care what any state regulation tells you. I don't care what on NCLEX, it is a standard. It is a national standard. As an LPN, you cannot take unstable patients. And if you have an stable patient that becomes unstable, they are no longer yours. Okay. So that's what you have to understand of what you can and cannot do. I don't care what a state regulation says. On NCLEX, it is a national standard, and on NCLEX, you cannot do it. I've never heard of legal nursing. Definitely going to look into that. Thanks for sure. Legal nurse consulting, Anna. Look it up. Look it up. I'm giving y'all a game right now. Shout out to all 100 of y'all. If you guys are new, we're doing essentially an Ask Me Anything. I'm a nurse. I've been a nurse for 3.5 years. I've been in the Navy for 16 years. I've been an educator for in January, it'll be 8 years. I've been a master instructor for about 8 years, so with my military background, medicine, been on 2 deployments, so I try to bring a lot of my experience into these learning aspects for y'all. I love jumping up here on TikTok, kicking the shit with y'all, and being real honest and letting y'all know what y'all are getting yourselves into. It's wild. The nursing field is wild, but it is very rewarding if you know how to navigate your way through here. Okay. Let's say I went to school till 2 p.m., then worked at General Motors until 11 p.m., all while being a mom. I know that's right. Any tips on how to study human body and health diseases? A lot of YouTube videos are good out there, like Khan Academy, Nexus Nurse, so on and so forth. You can check those out. Do exactly what it is asking. Don't think what if. Yeah, there is no what if. Don't do that. Because as soon as you do what if, you're going to get the question wrong. I'm not same as old days. Just ask, answer, and RN. What? How much do you make? How much do I make what? It says, so will you find some of the RN questions on the LPN exam? Yeah, you will. Thank you for your service. I appreciate your support. Thank you. NCLEX is let them know, Laura. NCLEX is the perfect world. You have all the resources you need and no one is going to die unless so. Yeah. Like, who do you take care of first? Like, who is going to die if you don't take care of them, right? Where's the NCLEX practice link? What NCLEX practice link? What do you mean? Laura, thank you for your service. Thank you for your support, Laura. Appreciate that. Khan Academy is excellent. I loved Khan Academy, especially when I was in prereqs. It was great. Any advice of learning the classification of pharmacology? A really good video for classification of pharmacology is on Simple Nursing's YouTube channel, right? I'm currently going for. So here's another thing that you need to know. The content that you learn as being an LPN, it is the same content that you will learn as being an RN. But once again, you need to understand who can do what you can accept, and what you can and what you cannot accept. Mike, it says, since you have your BSN, are you an officer? Someone I was a firefighter with was a Air Force BSN officer. So no, I am not an officer in the Navy. I'm still enlisted. I'm currently an E6 in the Navy. And to become an officer, you have to apply for it. You have to apply for it, and you have to meet all the criteria. I've been applying for an officer program probably since 2016 or 17, and I get denied. And then after a while, you kind of just get tired of doing it. So you're like, man, like, what do they want? And then afterwards, you just say, fuck it, I don't care. And so now I'm at the fuck it, I don't care. I got 4 years left until I retire if I decide I want to do that. And then, yeah. So I'm cool with being enlisted. Like I've been, I'm a supervisor. I'm like a work center supervisor or a manager for my unit. I manage and I supervise 50 people to include officers and senior enlisted, so I'm okay. I'm okay right here, doing my military expertise, managerial stuff. I'm cool with that. I'm in an accelerator program and it's a lot to learn so fast. Yeah, I was in an accelerator program. It was 18 months. There are some that are as low as 15 months, and Texas Tech has a BSN program that is 12 months long. And when I tell you it's a monster, it is a monster of a fucking program. What are the benefits of nursing over a medical doctor lifestyle? It all just depends on what type of nurse that you are. And with nursing, it all just depends on you and your outlook of life and what you want to do, to be completely honest. It says, Alicia, it says, hello, started OR recently, loving it, 21 years nursing, you work in Canada. Shout out to you, ma'am. Shout out to you. So you switched after 21 years of nursing, you switched to the OR. I bet you do love it, ma'am. I'm not even gonna lie to you. Probably should have went to the PACU, but because the PACU, I'm not even gonna lie to y'all. If y'all can get into the PACU, it is the holy grail. What is your salary? Is nurse worth the stress? So your salary depends on where your salary all depends on where you live. SG, that's number one. Number two is, I don't know what job that you think is not going to cause you stress, but every job will cause you stress. Nursing at the beginning, it is tough. Like everybody goes through imposter syndrome. Everybody goes through that. Everybody goes through the point to where it's just like, is this even worth it for me? But once you become a nurse and you can see how to navigate your way through the nursing system, then you'll be able to find a way, find things that are nursing or non-traditional nursing that may work for you. So it all just depends. So, and if you want to know my nursing salary, go to my YouTube channel and look up my first nursing paycheck, and that'll give you an idea. So if you guys want to know where the NCLEX questions are, it's nurselabs.com. Alejandra, hello, how are you? Dami says, I'm definitely going to Bridge RN. Thank you. And thank you for your service. I appreciate your support. Thank you. Retire. You look so young. Stop it. I've been in the Navy for 16 years. Just letting y'all know. Do you recommend a nurse residency program after graduation? So Tara, here's one thing I'll tell you, that schools and hospitals are pushing nursing residency programs for new grads. It's another way for them to lowball you on pay. And it's another way, but it's a way, if you find a good residency program, they will definitely, guide you in the right way. The thing that's been happening over the last couple of years for these nursing residencies is that they've just been really fucking shitty, like subpar training, and then throwing you to the fucking wolves. And that's the thing that I have a problem with. So do I think you should do it? Yeah, why not? Get in there, get your feet wet, get the job experience, take that job experience after a year or two, and then go somewhere else and start asking for more money, because that in the end, you need to be compensated for your skills. Because let me tell you something right now, RNs, LPNs, nurse practitioners, patient care techs, x-ray techs, all these people that are in medicine, y'all are fucking needed. Don't let these motherfucking people out here play with y'all. All right. If y'all love me, hey, make sure y'all fucking smash that like button. I'm giving y'all a game right now. All right. Make sure you smash that like button. Make sure you guys share. Make sure you guys follow. Also, make sure you guys check out those links that I got. 7-day NCLEX course, $48. I'm telling you, it's going away. And when it's going away, don't y'all come over here asking for it again. Where'd it go? I told you it was fucking going away. But I love y'all. And also, hey, I've been a coach for about 3.5 years too. So if you guys need coaching on NCLEX or whatever on life, fucking I got you. I fucking got you. But once again, like I said, if you guys want those free questions that I always throw a review on or whatever, it's nurselabs.com. What branch are you in? I am in the Navy. I've been in I'm in an NY program. It's 11 months. Lord have mercy. What is the PACU? The PACU is the post-anesthesia care unit, or the recovery room from when they come from the operating room, or when they come from like lower procedural rooms type deals like that. Graduated in December. How long should I wait to take my NCLEX? Ma'am, you need to take that NCLEX ASAP. That's when you need to take that for sure. Okay, you need to take that NCLEX, because the longer that you wait, you're going to start to data dump and you're going to start to forget shit. So you need to schedule it. You need to study for it. You need to schedule it. I would say schedule it or keep studying, but you need to schedule it, because by scheduling it, it holds you accountable. Now you're like, I got a deadline and I need to be preparing for it. Okay. Abby says, I need motivation. I still haven't taken my placement test for my prereqs. Ma'am, you better, okay. If you haven't taken so you need motivation. Here's what I'm going to say to you, Abby. If you don't want to be a fucking nurse, just say that. If you don't want to be a nurse, just say that. Right? You said you need motivation. You telling me, you say, I want to be a nurse. Okay, then put in the fucking work. Go take that damn test. Get the prereqs. Get that ass in school. Get that license. Stop playing games. Go make it happen. What type of nursing is less physical demand or easier? Well, bedside itself is it's wild. So, I mean, it all just depends on, I would say maybe dialysis nursing. I think dialysis nursing is one of those. I'm not saying it's like physical demand, but you're going to have demands. Like, it all just depends on the area of nursing. So I think dialysis nursing probably isn't too bad. Floor nursing, it'll really put a damper on you if you're walking and standing up. ICU, it all just depends on, what ICU that you're in. I would definitely think probably dialysis nursing is probably one of those. Do you suggest ER experience before going into the military/flight nursing? I think ER. So here are the big things that the military looks for, and these are what we call wartime specialties. War. So everybody knows what's going on in Israel and in Gaza and everything that happened in Palestine and all that good stuff. So there's a war happening that's over there. So think about it to yourself. What type of medical personnel would you need? ER trauma, ICU, OR, med surge, all of the big, those are what we call wartime specialties, right? So if you get experience in the ER or the ICU or med surge or OR, those are the things that the military looks for. And best believe if you have those, they are going to be like, hey, bring that at, bring it. Your live is harassment. Somebody said that my live is harassing. I don't know what that means. So hopefully I don't get cut. But yeah, so having experience in the OR or in those areas would definitely help you. That's for Jasmine. Hi, I'm taking all my prerequisites now, straight A students. Shout out to you. Shout out to you for Bianca for getting straight A's. But I just want to let you know, you just got to get A. You just got to get through it. You got to get through it. I'm a dialysis nurse 10 years, now nurse 24. What's special about the PACU? I'd switch for peace. So the thing about it in the PACU, you get two patients at a time that are coming from the OR. Biggest thing that you know as a nurse, that when they're coming from the OR, the biggest thing that we're thinking about is airway, right? At least the PACU that I worked in, you always had the help. The doctors from the surgeons to anesthesia were always like an ear away, close to the OR. So it's just like, it was just, they were easier to manage. They're there for anywhere from 30 minutes to an hour. Then they're gone. Then they're going up to the floor or they're going to the discharge area. So you're getting, it was just an easy rotation getting through it. So, we do PACU as well, flat out. So it says, can I get my ADN and be a nurse? Absolutely. Absolutely. You can. You can get your associate's degree in nursing and then get your license as an RN and then work as an associate's degree nurse. 100%. I have a problem with that too. You have a problem with what, Steno girl? Look, I'm like 35 comments deep. Deja, Miss Carter, ma'am, don't think I forgot about you. All right. I know we talked about some stuff. I got you. Can I get my ADN as a nurse? I have no prior college experience. Yep, you sure can. My daughter graduated in August with her BSN. She took her NCLEX in September. She passed. Rita, congratulations to your daughter. Shout out to her. My feet swelling. I don't know. Your feet swollen? I bet. Hospitals are a-holes when it comes to trying to negotiate. You damn right they are. RN here with home care agency trying to play. Oh, I bet you they are. They always trying to play with y'all because they're trying to lowball you and then give y'all massive amounts of a patient workload, which is ridiculous. I'm in school for RN, but feel like giving up. It's too much. I cannot retain the information, sir. At this point, this is where you need to really determine what you want. Why did you become a nurse? Understand what your why is. Is it for Yasin Noble? Understand why you became a nurse. And you have to put in the work. So here's the thing. You say you can't retain information. So what type of learner are you? This is something that I do with my students when I'm coaching them. Are you a read-write? Are you a auditory? Are you kinesthetic? Are you visual? Are you a combination of that? Figure out what type of learner that you are and then learn that way. Like I like audios, like I love listening to podcasts. So I'll put a YouTube video on while I'm driving to and from work or wherever I'm going, and I'll just listen to it and I'm able to retain it. Or I'll listen to it in the shower, or I listen to it when I'm in the toilet, like whatever. You know what I'm saying? Figure out those ways that you can retain information and then capitalize on it. What if I'm having an allergic reaction to some medications? If you're having an allergic, first of all, we don't give medical advice. No one in this chat will give medical advice to anyone. And if you're having an allergic reaction, I would recommend you call the nursing hotline, or I would recommend you go straight to your nearest emergency room. Like we don't give medical advice in here at all whatsoever. I want to offer my time, help students study for the NCLEX. Steno girl, do it. What's it say? Stay stuck or move forward. Your choice. Facts. Stop shouting. Who are you talking about? Who's shouting? Princess, what you mean? Infusion's a good one. I'm taking an LPN course. I want to do wound care. Princess, you can do wound care. You can actually specialize in wound care and get a specialty. Yes, one patient. Chronic dialysis nursing is hectic. Do acute. Okay. I'm too young for that to take a vaccine for allergy reactions. What? King, what's up? It says, what is nurse-patient ratio for ICU neuro? Usually it's 2-1. Mental health as well. That's a crazy one too. How do you feel about LPNs? I love LPNs. User 20, you must be new here. I love LPNs. What is the cutoff age to join the military as an ICU nurse? So right now, I think the cutoff age is 42, but there's always waivers. There's always waivers for stuff. And trust me, a lot of things are popping off in the Middle East right now. They will waive everybody with experience that they need. Trust and believe me. Any tips for med surg, especially regarding memorizing drugs? I struggle bad with meds. So miss whoever that person is with the fingernails getting painted. You need to get into a small group. You, 3 other people. split up the work or the chapters 25%. So if there's 16 chapters, 4 chapters per, and then do 25% of the work and then put it all together. You do 25% of the work and you reap 100% of the benefits. So I would try that. To advance your degree, your GPA counts. Good job on getting all those A's. So yeah, that's debatable. That's debatable. I've seen people get C's all through their bachelor's degree and then, go work 3 or 4, work 2 or 3 years and then get into an MP program. It's debatable, but if you get A's, cool. That makes you look good in school. You know what I'm saying? So, see, that's why it took me forever to decide on nursing, because I always thought you had to have a BSN. Nope. Can you get an RN and practice in the field from? Absolutely. You can get absolutely. I have a herniated disc. Can I work as a nurse, as a radiology tech? Radiology tech best for me? If you have a herniated disc and you're working as a rad tech and you got to be up on your feet doing all kinds of stuff all the time, then being a nurse, it all just depends on what type of nurse that you want to be. You could be a nurse and work in radiology too. You can work in the cath lab, you can do all those things that have to do with radiology. You can still do that as a nurse. They actually have a specialty where you can be a radiology nurse. Did you know that? Now you know. I failed MedSearch HESI. How can I pass it? Any advice? You need to restudy for it. You need to figure out why. You need to figure out what it is that you don't understand, and you need to audit yourself. And it can be tough. I'm an RN, went into research, took me years to find my place, tried a bunch of things. Dudley, I love that. Now you do research. Now you don't do anything necessarily with patient care, but now you're still being an intricate part of the nursing field by, telling that information like that. Me too. I learned better with audios. For facts. Shout out to everybody that gave me a follow. RT here. I am thinking about going for my RN. I am nervous about med dosage. Any advice? There's some really good YouTube channels out there. One that I really liked was there's another one called PharmD, I believe. But Simple Nursing has really good pharmacology videos, in my opinion, that I like, that I've used in the past before. I'm definitely new. Well, welcome. I'm glad you're new. Make sure you smash that like button. Make sure you follow. Taking up nursing. Okay. I had one interview in the cardiopulmonary unit yesterday and ER today. Is 28 lowball amount. It depends on your area, Rita. It depends on where you live. And that's usually, you said your first interview. So if you're working there, usually they're going to start you off at that price for about 6 months, and then they'll give you a pay increase. Usually I would definitely ask a lot about that. Do you feel you lost skills doing PACU? I graduate next semester. Everyone says not to do it. Let me tell you something right now. And I don't give a fuck what anybody will tell you is, when you start to advance your skills of being a nurse, you will start to forget a lot of the things that you learn while the skills of being a nurse. I'm telling you, right? So when you're in PACU, you don't lose your skills because you still have to assess your patient. They're going to come out. The very first thing, the most important thing when they come out is airway compromise, because most of them are under general anesthesia. You still have to do that. That doesn't go anywhere. Same thing in the OR. Okay, I have a patient that now they're airway compromised. Now I have freaking anesthesia over there doing their thing. We still got to push meds. We still got to call a code. We still got to do CPR. We still got to do all those things. In the OR, it's a little bit different because you still have a sterile environment. You know what I mean? So go to where you want to go. Stop listening to people and go to where you want to go. All right. People are going to be like, oh, I don't recommend it. Okay, well, it's not your fucking life. I'm going to do something else. I'm telling you right now. And I've worked in all those. I haven't worked in the ICU in a long time, but I still know how to titrate drips, and I haven't titrated a drip in I don't know how long. You know what I mean? I still know how to pay attention to my patient and my monitor while I'm dropping some Levofed, right? So it's just like riding a bike. You never really truly forget. You may be a little rusty, but you can still be up there doing your thing. So let's see what else. Appreciate the follow. What's the best field to work in as far as pay and stress? Let me tell you, with more money comes more problems, right? So if you're talking about the best field in nursing is the CRNA, they make the most money. But you gotta go do your prereqs. You gotta go work in an ICU, then you gotta get into a CRNA program, which is already tough as it is. And then you're gonna be out here working as a CRNA, you're gonna make the money. But the money comes with a lot of responsibility. With more money comes all that responsibility, which is not a bad thing. So is it Jaren? It all just depends. It all just depends on the area. It says, do you just do remediation for failed HESI? No, I do strictly NCLEX. So NCLEX prep, coaching for that, stuff like that. So, I mean, can I do that? Absolutely. But do I do that? I do not. Hola. Sir, yes, sir. Hola. Steno girl. I'm a clinical instructor. Shout out to you, Laura. It says, Jamie, I said I started nursing and dialysis. Want to switch hospitals. Best advice on adjusting and refreshing. Of course, anytime, I would say YouTube. And if you're trying to switch hospitals to do dialysis, I mean, essentially that they're going to put you through some type of training. Like everybody has an orientation. So how do you guys afford to live while in nursing school? Most people work full-time jobs. That's how they do it. Listen to me, time management. Okay. In Alabama, info is for my daughter, not me. Okay, Rita, I got you. I'm picking up what you're putting down. It says Ed 89 or 8D. It says you never lose your skills in clinical setting. You don't. Appreciate the flowers, Neek. Is it Nikkei? Neek? Thank you. It says, how do you guys afford? Okay, I already answered that question. OR nurse, you will lose your skills. Yep, you won't. I read that wrong. It says OR nurse, you will never lose your skills. You won't. Tessa, you're welcome. It says, hi, Kevin. I graduated 2 years ago. What are your suggestions on the best study materials for NCLEX? So is it my? Here's one thing I would say to you. It's not necessarily about the program is definitely a big part of it. But the biggest thing is you. You have to really sit there and audit yourself and figure out what is it that didn't work for you in the past, or what is it that hasn't worked, and how can you fix that? Like, did you not recreate the testing center? That's the one thing I like to compare this to. Like NFL players, right? They practice. College players, they practice. And then they get 1 day a week for them to go out there and show out. So think about you studying for your NCLEX as you practicing and then going out to the national championship when you go stay, or when you go out there and you take your NCLEX, right? And so you have to practice. Is it the environment? Did you recreate the testing center? Do you not understand content? Do you not understand questions? Like, those are those different things that you really have to think about. But you got Hearst, Kaplan, you got Mine, which is still being created. Hey, $48, by the way, go over there and check it out. You got NCLEX High Yield, you got Archer, you got UWorld. They have so many that are out there. There's so many I could recommend. I'll always recommend my first. So Colton says, I'm done with healthcare. Colton, I don't blame you, man. I don't blame you. Pack you for 23 years, best learning experience in my career. Had to be able to make quick decisions. You do. Bama, let them know. I heard the same thing about OR residency. Everyone was against it. I did what was best for me. Do what is best for you. What is the difference between the T's versus the T's versus the NCLEX testing? So it depends on what T's. Are you talking about like the entry level, or are you talking about the T's as in the T's ATI that they give you during school versus the NCLEX? I personally have never taken the T's, but for everybody that says to me is that it's not comparable. It's 1,000 times harder. And let me tell you something right now. Most reviews will be harder than the NCLEX, because if you study harder when you're practicing, when you go and you take the exam, you're like, oh, that didn't feel so bad. Are LPNs taught the same as RNs? Yes. No. Here, I take that back. Our LPNs are taught based off of their scope of practice, but RNs and LPNs learn the same content. But you need to know what you can and cannot do, what you can and cannot accept. Like LPNs cannot do blood products. Some state regulations say that they can, but according to NCLEX, you cannot administer blood products. You can't. Okay. My last day of nursing school is Friday. Ebony, shout out to you. I know you happy. Hey, but you see the light at the end of the tunnel, but we can't stop running. You got to run until you're past that. You got to run until you're past that finish line, which is you're passing your NCLEX. Okay. LPN for 5 years. I haven't had a great experience in long-term care. I bet you haven't. I have 2 offers, children's home and hospice. Okay. Then Crystal, do not pass go. Do not collect $200. Take that ass somewhere else. So, and I hope you do have a better experience when you go. I hope you have a better experience at one of those places for yourself. Is it possible to start out in the ICU as a new grad? Yes, I started out in the ICU as a new grad. And I worked in a burn ICU, loved it. Then I went to a medical and neuro ICU, and then that's when shit hit the fan. It was during the second wave of COVID, and it was wild. It was just something that I just was not, that nobody was prepared for. And then it's just like, it wasn't necessarily the people that I worked with, but it was administration that just made it very difficult. And I was like, you know what? I don't need to deal with this. And so, and I'm telling you right now, they put your license in jeopardy. And I'm telling you right now, no one ever will put my license at jeopardy. I work too hard for it. Y'all work too hard for it. Don't let these fucking people play with you. Don't let them play with you. Here are nurses. Here our nurses. What? Here our nurses have a really easy because clients are either going in and out. Oh, you're talking about for PACU. Yeah, for sure. I feel like you are one of my professors. I got you. You already know the deal. Look, happy mom. You already know the deal. You've been here plenty of times and know what's up. Content and costs. So go over and look at the link in my bio right now. It's full of content. Has 42 content videos. It's $48. We're projecting to put 150 content videos in there, but the price is only lasting until Black Friday. After Black Friday, it's going up, and it's going to subscription base. User 57. Hi, it's Kevin, not Kelvin. I don't got a L in my name, but that's okay. So it says, Happy Mom says, why nobody want to work with children? I love baby. Hey, it's an acquired thing. Working with babies scares people. Like it really does, because babies can decompensate extremely fast. It says, hey all, I just got accepted. I'm nervous to go back to school at 31, but excited to. Hey, look, let me tell you something. There's a lady I'm coaching right now. She's 51. She's taken her NCLEX 11 times, and she's still not giving up. Your age has nothing to do with you doing anything. Trust and believe me. I had a brain aneurysm rupture 2 years ago, and that made me want to be a nurse. Mike, you probably had a really good experience with those nurses that were taking care of you, and that is your why. And I love that. I love that is your why, is because you want to take care of people the way that people took care of you. And that is wonderful. And always hold on to that, and never let whatever stupidness that's going around within your area, your environment where you're working, never let that deter you ever for why you do or why you're doing what you are doing. Okay. So I love that for you. I don't love the fact that you had an aneurysm, but I do understand that is your why. And I love that is your why for why you want to go out there and do great stuff. I work in med-surg surgical. That was the hardest job ever. I bet it was. Is it compulsory to do CRT, and do you get extra money for it? No, you don't. Well, some places will say, oh, we'll give you an extra $1 if you do CRT. But some hospitals are just like, no, it's a part of the scope of practice if you're an ICU nurse. So $48 one-time payment, that is correct. Right now, it's in its pre-launch phase, so you get it forever. And I'm telling you, it's going away. I'm letting everybody know it is going away. I actually had a testimony just recently where a guy, he used my 42 videos that I currently have up there. He passed, and he's a nurse as of October 26th. He got his RN, so it works. I'm a new RN for 6 months, and I started in tele, but the hospital is not for me. Help. Well, here's the thing. It's just like, what are you going to do? You're going to stay there. You're going to get the experience. So right now, you're at the 6-month period. You're in your imposter syndrome, right? So there's still a lot that you have to learn, right? But if they're playing with your license, if the ratios are bad, I'm trying to tell you, documentation of everything is on your part. Because let me tell you, a hospital will toss you out like you were yesterday's trash, and they will get 2 people to replace you, or 1 person. So trust and believe me, like, you are expendable. When I tell you you're expendable, that doesn't mean that you aren't needed out here, because they need you. Trust and believe me when I tell you that. If you weren't a nurse, what would have been your plan B? Honestly, I probably would have jumped into marketing. I actually probably would have jumped into marketing, but I did think about doing X-ray as well. If I could probably go back all over and do it again, I probably would have done X-ray. So shout out to all my people that do radiology. Pediatric is scary, and the pills at the heart. Yeah, it does pull at your heartstrings for sure. I work in rehab. I'm a new nurse, but it's been crazy. Feel like I'm going back to the hospital. It does that to you. I am struggling. Any tips for psych part for a nursing exam? So I'm just key. One thing I could tell you about psych is that it's all about therapeutic communication. It is really all about therapeutic communication. Starting oncology next week. Any advice? The biggest thing about oncology is understanding everybody's pain is very different. I've never worked in oncology. However, I've taken care of cancer patients that have passed away on me. With people that have cancer, you definitely have to have really good therapeutic communication, not just with them, but with the family that is also going through that period of grief with them as well. Amanda says, any tips for new grad RN job interviews? So one thing is, there's so many different questions that people say out there, but you have to go with a notebook full of questions. Go with a notebook full of questions, as in, like, how long is the orientation? How many preceptors will I have? What's the starting pay? What is the chances, or when does the pay increase? Because stuff like that is important. Also is what is the patient to nurse ratio? That is important. If you're going to a place and you're working med-surg and they're giving you 8 patients, that is a no-no. If you're going to an ICU where they're going to give you 4 patients, where it's like, they're all on vents and shit, that is a no-no. That shit happened to me, right? So those are the type of questions, those are one of many important questions. Hey, for everybody that's here, hey, drop the questions in there. What do you think are some really good interviewing questions? Okay. What's going? It says, is there online RN CHOP? I don't know what that means. Thoughts on case management? Case management is cool. What do you mean by playing with your license? So putting you in situations that go against, your ethics and your morals, and putting you in situations that spread you thin to where you can't take care of patients properly. That's what that means. They'll be like, hey, we got to do what we got to do. But according to state legislature or according to certain, documents and depending on where you work and the acuity of your patients, you can't have more than a certain amount of patients because it spreads you thin. How can you properly take care of 8 patients? Especially if they're spread out all over the floor? What if you have a patient that dies and you don't check on them for an hour because you're in a different person's room? And because trust me, there's stories of that happens. You can ask any experienced nurse out here who has been put in a situation like that. They will play with you. And then guess what? Here's a really good one. Everybody know about the Redonda Vaught. If you guys don't know anything about her, I would suggest that you guys look her up. Granted, she made a medical error and stuff like that, but the hospitals will play with you. They will throw you under the bus and get rid of you. Trust and believe me when I tell you that. Been a CNA for 25 and a half years. I'm 55, retired, so over it. I'm getting paid from 2 pensions. Next career, shout out to you. Wait, why radiology though? I don't know. Honestly, I feel like I would have liked radiology a lot better. To be honest, that's just. I said, I was like, man, if I could do it all over, I would do radiology. And you really don't have to do too much of the patient care. It's just, you go in there, you do your thing, and then they're gone. Like, you don't have to hold on to them, or you don't have to be around them too much, But don't get me wrong, I do enjoy the patient care aspect of where you get to know people. So that's not a bad thing either. Lacey says, if I could do it all over again, I would have done healthcare management. Yep, I can see that. When I pass, I'm coming to find you. I want a signed autograph and say we did it. I know that's right. Can you repeat, please? I don't know what you want me to repeat. Thank you. I appreciate it. Amanda, you are welcome. It says, what's the turnaround rate and why? What's the death rate? What do you mean, happy mom? Sue says, will you get pulled to another floor when they are short? Absolutely, they will pull you. They will be like, hey, we need somebody to come here to do X, Y, and Z. So I know that you guys have your census, but I need some people down here, and they'll do it. And they'll send you too. Trust and believe me, they will. What is it? I'm a home care 2 years. Would you recommend me starting in a hospital as part-time or per diem? I think it would probably be, you could actually do both. You just do PRN and they'll pay you PRN status. I would do per diem because if you do per diem, I think you can essentially work when you want. Part-time, they're going to be like, oh, we expect for you to be, here. But with per diem, you can do per diem at different locations as much as you want or as little as you want. You really can be in control of your own schedule. Food lover, is there any options or any option if I don't like to work bedside? There are a ton of options that you could do not working bedside, right? Hell, you could go get a job working at an insurance company as a nurse, doing chart audits and contacting doctors and stuff like that. Like, you never have to touch a patient again. Interview question, what is the culture in the unit like? Laura, love that question. My situation is different. My husband is... Tanya says, this is good. My daughter just passed the NCLEX Saturday. I wish I had this when I was practicing. Here's the thing, Tanya, is like, I rarely see, well, there's another lady, her name is Nurse Erica. A lot of people are just like, man, she's radical and she does this and she does that. And I actually, some of the things she says, I don't mind. Some of them I'm just like, that's kind of crazy. But, the biggest thing is that we have to advocate for one another. I know it's getting kind of dark, but we have to advocate for one another. And this is the platform that I decided to do it because, some people are so scared. Like, people, I come up here and I talk about my experience about the ICU. I actually have a series of why I quit the ICU, right? And somebody got in here, they were just like, I hope your hospital sees this and, because they're going to retaliate against you. You think I give a fuck if this hospital sees about me telling the truth? And I haven't even named any hospital that I've worked at. So people are just like, they're going to retaliate against you. Okay. And I still got a license. Like, what you mean, bro? Stop playing with me. So I'm out here telling people and giving people what I wish somebody would have gave me, like the reality, like working in a hospital. not the business. However, in order for you to excel in certain areas in nursing, you have to go to a hospital. You have to. And here's the thing about bedside. Bedside can work. There's some people that love working at bedside, and there's no shade on them for doing that. But for me, no, I'm good. I can still impact people and not work at bedside. And that's what people need to realize. Being a nurse, an RN or an LPN does not mean that you have to work bedside. Remember that, people. Remember that. Ask what their unit or facility has to offer you. Yep. Will I be forced to work overtime under the threat of my license over abandonment? So here's the thing. You can't. Okay, so now you can't. They can't get you for patient abandonment if you haven't accepted an assignment. Now, if you're there and you work 12-hour shifts and they're just like, hey, we need for you to work another 3 shifts or another 3 hours because somebody's not here, blah, 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 then yes, you are obligated to stay there because it will be a patient abandonment at that point. Right. But then it's just like, you could very well just be like, hey, I'm not coming in the next day. Or I'm very, there are ways around that. But the moment that you accept the patient and then you do your 12-hour shift, you're like, all right, I'm out, peace. And then you haven't given no turnover to nobody, then they will get you for patient abandonment. And they will send that ass to the Board of Nursing, and they will do everything in their fucking power to get ready to take your license away. Trust and believe it. Non-bedside RN jobs, facts. I wish I could go back and do radiology. You could do radiology as an RN too, or I don't know if an LPN do it, but I know you can do it as an RN. I don't want to do bedside trauma or ER, then don't do it. COVID in, yeah, oh yeah, that's right. Is there any non-bedside jobs? Absolutely, there's tons. Per diem is amazing. Let them know, Joyce, let them know. COVID numbers in NYC are up. Yeah, the numbers were up here too in Texas as well. Hopefully it back to. We used to get pulled from ER to ICU often. Yeah, I got pulled from between 2 ICUs, from medical to neuro. And then one time I got pulled into med surg, and I was just like, oh my God, like, cool. I like this. But then I had 6 patients and I didn't like that at all. I was like, what are y'all doing to me? Quality improvement is non-bedside. Sure is. Happy Mom says, I think I want to do travel nursing because I love traveling, but I thought about working small. So here's the thing is if you decide to become a travel nurse, you need to get experience first. You need it about the bare minimum. You need a year. It's more recommended that you have 2, because as a travel nurse, you're going to get paid more than staff nursing. And trust and believe me when I tell you, those nurses are salty as fuck and they will give you the shitty ass assignments. Ask any travel nurse around here. They will do it. Trust me. Case management. What's up, Sandy? How are you? Do you have a free trial for your course? Natalie, I do not. It's $48. There's no free trial for that. Sue says, I never worked with vents and trauma, respiratory, set it up. I don't know much about the setting. So this is where, honestly, go to your respiratory therapist or your respiratory techs and ask them everything that you need to learn about the vents. I didn't know anything about the vents. And so I had RTs teaching me. I fucking love RTs teaching me. Like, show me what I need to do to keep this motherfucker alive until you get here. They were just like, hey, high pressure alarm, low pressure alarm, perfect hats. If you need to suction. If it comes undone, do that. Call me if anything else. And literally that's how it was. And then when we had time, they would break it down of, about the different settings, what the FiO2 actually means, so on and so forth. Like those things are great. Like get all your training from your RTs, trust and believe me, or a nurse who knows the vents very well. Sandy, of course, you're welcome. Yeah, you and that Korean male nurse tell the truth. What Korean male nurse? What is that? That's me, bedside. I know that's right. What does that say? Admin could care less about nurses, need us, but will replace us. And Laura, they will. You already know. What's your advice for someone 40 going back to school to be a RN? Am I too old? No, Rico, you're not too old. I want to leave bedside so bad. Paige, then leave it. Then leave. Then leave. You know what I'm saying? Facts. Tanya says you need that experience when you're new to be marketable in the beginning. You do. Sky, what's up? How are you? I hate bedside because of CNA since 2018 and medical assistant. I got you. James, what's up, my good man? I appreciate you being here. Hey, so if you guys don't know James, he's one of the guys I follow. He's a business mentor of mine. Super, super cool guy. Shows you how to do all kinds of stuff. Hey, nursepreneurship. If you want to know how to, create a product for yourself, like a digital product that, you can put on autopilot with work, of course, that's the dude that can definitely help you out for sure. What does it say? Bedside 9 years, moving on to acute care. All right, Danielle, go ahead with your bad self. It says, I have my nursing degree, but I can't pass the NCLEX for 4 years. Is there, it's there. I can do it without, no, you can't. You can't work, not in the United States. You cannot work as a nurse without a license. I'm eating pizza. Look, I want pizza really bad now. It's routine to have 13 patients. Say what? So where? What med-surg to have 13 patients? Look, I wouldn't even be working there. People underestimate the skills required to travel. That's what I'm saying, Ghost. Like, you got to have the skill because they will toss that ass under the bus. Hell yeah, they will. They will throw you to the wolves and travel nurse. Yep. Most places want 2 years for travel nurses. Hey, when COVID was happening, they were getting brand new boot ass baby nurses. See, I'll use both terms. They have both of them. And then next thing you know, you got these nurses that are traveling and they're going to those COVID units. They don't know nothing about nothing. And then they're buckling and then they're leaving or they're getting, they have all these. It was just a shit show. It just was not. It was not it. It says, baby, we need some Carmax. And look, it's dry out here. It's dry out here. It's cold and it's dry. I live in Texas. Right now it's like 40 something degrees. I'm usually not all the way up on this. So, hey, I get that Carmex, but I ain't getting it right now. So look, we chappity chap out in this motherfucker. You know what I'm saying? So Sandy says, Kev, to keep them alive. That's what I'm saying. What does Eliza say? It says, hi, what is this that is being offered for $48? It's my NCLEX course for $48. It's in its pre-launch phase. That's what's being offered for $48, right? And so everybody that gets it right now is part of the early adopter phase. So you get all of my content videos and then some even special stuff that's going to be coming later on down the line. You get it for $48. That is what that entails. And that was for Eliza. Erica says, I was a traveling CNA and they gave me the most difficult cases in every facility I worked. I bet they did. Barbara, hi, how are you? Miss Cindy. It says, I feel so afraid of the ICU. I want to do, but just afraid. You have to get through that phase. Like going through the ICU is very intimidating because there's a lot that's happening. You have to develop your time management at such a fast rate when you do ICU. Not saying that it's not any faster than anywhere else, but you're dealing with the most critical patients in the hospital. So you do have to do they don't do central lines, like in any other floor, unless, mostly in the ICU, or they'll do them in the trauma bay or in the ER, right? But, they don't have central lines on the floor. Like those nurses don't do that, or they don't titrate drips. They don't do amiodarone. They don't do cardiazem drips. They don't do anything that's titratable unless it's in the ER or unless it's in the, most time in the ICU. But it all depends on the facility that you are working in. At least in my facility, that's how it was. Okay. So you have to put yourself in that situation in order for you to learn and for you to grow in the ICU. Okay. Any nursing jobs that specialize in trachs, that would be the ICU. And then of course we want to do flight nursing. They intubate and do all that stuff too. I start my residency program in the MICU next February. Shout out to you, Ghost. What's the best non-nursing RN with good pay with 10 years of experience? Ma'am, go over to I'll give you an example. Go to Aetna. Go to Aetna, which is the insurance company, right? Go to Aetna and then look at the careers and then type in RN and then type remote and then watch how many remote nursing jobs pop up. That literally will start. I've seen the highest pay for those remote jobs like $120,000 a year. And you have 10 years of experience. Go over there and look. That's just one example. Should we take internship into a hospital? It all just depends, Sandy. What do you want to do? Most of those internships, they want you. I mean, that's just another way for you to build your skills. So why not? 4 years of failing NCLEX. Oof. Yeah. Hey, I failed the NCLEX 3 times, y'all. And I passed on the 4th time. But none of y'all would have known that at all unless I told you. And let me tell you something right now. No hospital cares. No hospital cares. Other people just hey, you're dumb as fuck, bro, for failing the Hey, shut up. Shut up. Shut up. No one fucking cares how many times you failed that exam. You need to pass that exam because they want you to take that ass to that hospital and put in that work. That's all that means. Who's the person that can help with digital nursing products? It was my buddy James. He might not be in here anymore, but it was my buddy James. He was in here watching my live. I stumbled upon your wall. I know nothing about medicine and can't do bodily fluids, period. Oh, hey, It's an acquired thing. It's an acquired thing. You know what I mean? Who gave me a dinosaur? Y'all gave me 3 dinosaurs. Hey, Daniel. Is it Daniel? Hey, I appreciate you. I appreciate the dinosaur. I never got those. No, 6 to 7 max and med surge. Look, I've seen them give like 8, 9. I've seen somebody give them like 10, and I was just like, ain't no way in hell. Ain't no. I would, as soon as they would have been like, hey, here's the assignments for the day, I would have been like, nope, I'm out. I would have literally went home, because the moment that you accept it, that's where they get you for patient abandonment. I would like 10 patients. All right, I'm out. Sorry, not happening. What city are you in? I live in San Antonio. Yeah, COVID really tested skills, not education. Appreciate the lightning bolts. We call them agency nurses. They'll call them agency nurses, travel nurses. Now they have the other ones like the FEMA nurses or the STRAC nurses or something along the lines. I got an ice cream cone. Thanks, Sandy. I appreciate you, girl. What else? It says, I'm just messing with you. Oh, okay. I got you, Janine. Hey, these motherfuckers feeling kind of dry right now. And they're pretty fucking big too. Like, I ain't even gonna, no cap, as the kids say, right? And it's cold as hell out here for no reason. For no reason. Howdy, Kevin. You a chief yet? Daniel, don't play with me, sir. I'm still a first class, bro. We don't do chiefs around here. Even though I could very well, if I put in the effort, to be a chief, but I just don't want it. I am stressed with NS having my midterm on Friday, and I am borderline of passing and failing ALP. Yo, are those jellyfish? Man, fucking Portuguese man awards? I appreciate it, man. Appreciate the jellyfish. I didn't even know they had all these different things on here. But is it Estefany? Ma'am, you got to put in that work. You really do. It says, I'm doing my prereqs for nursing. Got 3 more classes trying to get into a program. Hey, don't try. Do it. Right? We speak things into existence around here. Right? Hey, I'm getting into a nursing program. It doesn't have to be a specific one. I'm getting into a nursing program. Say it. Say it to yourself. Speak things into existence, and it shall be so, right? I'm a big person of words of affirmation. If you come to me, Kevin, I'm trying to do this, I'll be like, how about we say, I will do this? How about we say that? How about we say that? Of course, in a positive light. Don't come over here and say, I will crash this car into a tree. We don't want you to fucking do that, because then you're going to be a patient at somebody's fucking ER, and then they ain't going to like you. Okay? We ain't doing all that. It says, I love this, man. Y'all, it is the most respectful way and true bless. I'm coming. That's what I'm trying to tell you. ICU and other specialties doesn't like to hire, especially at the beginning. Look, I walked up in there and I let them know what the deal was. So, I live in the South, right? I live in Texas. Now, if you live in the dirty South on the East Coast, demographics can be a little bit different. So, Justine, I understand you on that aspect. I do. But I didn't have a problem, and I think the reason why I didn't have a problem is because of my military background of me getting into an ICU. But yeah, they do gatekeep. I've seen that. See, this is why I don't fast pass unless I'm in CPR. Okay. We do all the drips in the IMU. So I'm telling you right now, like in my IMCU or the step down, they didn't do drips. They wouldn't even take them. They wouldn't take them. Even though they're supposed to do them, they wouldn't take them. So I was just like, yeah, he's on 5 Bacardi's. They're like, what? No, we can't take him. What do you mean you can't take them? What you mean? But it was their policy. But that ended up changing at some point. But when I was there, that was not it. Let's see. LTAC with mad trachs. There you go. Hey, that's where you get a lot of skills at, too, if you want to learn about trachs and, alternative airways. But ICU, you will have like 6 months of training. Let me tell you something, Justine. That is not what happened to me. They gave us 10 weeks, 12 weeks of training, and then they were just like, here you go. And when I tell you, that was the biggest shit show I've ever seen in my life. I was just like, how is anybody going to learn anything? It's supposed to be 6 months, but it wasn't. And that's another reason why I left, is because it's like, y'all expect for me to do all this, but I haven't even been exposed to it. Even though I had been exposed to a whole bunch of other stuff, but there were some things I just wasn't exposed to. And I'm just like, I'm asking questions, and they're just like, figure it out. I could have punched them all fucking in the face when they said that to me. Are you kidding me? I just started my orientation in med-surg. Go ahead. Is it Lily? Lily? Go ahead, girl. Who's the person who helped you start the product? Steno girl. Hey, hit me up. Hey, send me a DM, and I'll send you his name, because he's probably not in here anymore. True. Man, you guys are dry. I'm like behind like 42 something. My bad, y'all. I'm gonna hang out here for another couple minutes because your boy getting hungry. It says, what do you know? Do you know anything about correctional nursing? I don't. So, I mean, I know a little bit about correctional nursing, but I've never worked in correctional nursing. There's a bunch of nurses that jump into my chat all the time, and they'll be like, I've been working corrections and I love it. Her name is Nurse Cass. She's not here. She's been doing corrections for like 17 years. She will fight you. That's all I know. But corrections nursing, most nurses that I know that are there, they love it. They do love it. Ice cream cone. I appreciate y'all. I want to do flight nursing. If you want to do flight nursing, you need to get, is it Lily? You need to get into something along the lines of like you need to get ICU and you need to get like ICU or ER. More the ICU because you're doing the en route care. So you can intubate, you titrate drips, so on and so forth. That's where you need to go. Yeah, that's a San Antonio looking fence behind you. Hey, look, first of all, don't do that. Don't do that. Okay, don't do that. I'm doing my prereqs now. What's the best field? Was doing it for case management. It all just depends on where you want to go, Jackie. It depends on where you want to go. Y'all scaring me. It's not about scaring you. It's about making you aware. If you're scared, go to church because that's what it's for. And of course, to praise whatever higher being you go to. But if you're scared, go there, right? It's not about making you scared. It's about making you aware. That's it. I love San Antonio. Was there when the Riverwalk first started across from the Alamo. Great food. Hey, we live here in San Antonio. We don't go down there. We don't go down there. But San Antonio is a great city. I love it. I've been here for almost 10 years. I love it. Do you think Kaplan CAT exam helped for NCLEX exam? My package for Kaplan will expire this month. I liked Kaplan. Kaplan was great. I actually made a Kaplan review on my YouTube. I put it on TikTok. I put it on my Instagram. It's great. There is power in that tongue. Facts. There's facts. There's power in the tongue. Facts. But I'm only speaking based off of my experience. I really should just get into motivational speaking and stop playing games. Do you guys have Hondros College of Nursing in Texas? I don't know. We might. Yes, we are getting into that program. I know that's right. I'm getting into a nursing program. Amen. 100% believe in manifestation. Love it. Do you think PA is better than RN? I think that PAs play a pivotal role in medicine just like RNs do. And it can't be a dick measuring contest. It can't be. Sorry, hey, excuse my language, y'all. I'm a sailor. My bad. I'm sorry. I'm trying to get right with the Lord at some point, right? But it can't be a competition. Everybody plays a pivotal role, and that's what people fucking forget is that we're all on the same fucking team, so we all have to respect each other's scope of practice and we all have to respect each other's knowledge that what we have. If you don't know something, ask, like as an RN, they're like, oh, as an RN, I didn't know you guys do that. Yeah, exactly. As a PA, I didn't know you could do that. That's where people forget. And that's where it becomes such a divide in medicine, right? And that's what people forget, right? So do I think PA is better? I think that everybody plays their role. And I have some friends that are PAs. It all just depends on what level of nursing that you can do and what they do as a PA, because PAs can specialize as well. I'm going to pass that NCLEX on my third attempt next year. I know that's right. What do you think about correctional nursing? I think I already answered that. I'm a new grad and I just got a job in the NICU. I don't know if it's different from regular. It is very much different. It is very much different dealing with ICU or, neonatal babies. It varies because, babies are, not saying the anatomy is different, but they are very different. And so that'll be your love and your passion. I just got a new grad offer to the critical care oncology. Shout out to you. What else we got? Do you think my skills will diminish being a new nurse and working? No, I don't. We talked about that earlier too. Just one section. Hello. What's up, Sharon? I'm trying to catch up. I want to do travel nursing. How much experience should I have before doing it? Catherine, you want at least a year to 2 years of experience. Babies are cool. Baby nursing. Let's go. Hey, shout out to the baby nurses. Okay, Lily, no problem. Thank you for your advice. I'll do the ICU. Not ready for the ER. Hey, the ER is controlled fucking. No, the ER is pure fucking controlled chaos. That's exactly what it is. But hey, if you can, it's kind of like going to New York. If you can make it there, you can make it anywhere. I'm just being honest. When did you become an RN? I became an RN in 2020. So I've been a nurse for a little over 3 years. I've been in the Navy for 16 years. I've been an educator and a master instructor for going on 8 years. It'll be 8 years in January. So they've gentrified the Riverwalk by adding all those damn. Hey, look, let me tell you something. Some people be getting really out of control with these damn dog parks, dog bars, whatever. I have a dog. I would never take her to any one of those because I don't trust another motherfucker's dog. I'm just being honest. That's like, what does it say? That's like, I'm from New Orleans, never go to Bourbon. That's what I'm saying. Who does that? Who does that? I went down there one time and I was like, ew, I want to go home. Christian says, I'm getting into my RN program or my nursing program. I know that's right. I'm 12 weeks into my RN program. Any suggestions for websites that help quizzes or retain information? There's so many out there, like Nexus Nurse is another one. PharmD is another one. Simple Nursing. There's a ton of Khan Academy is really good. There's so many on it. I almost went into a PA program, but yeah, I got you. How many times can you take the NCLEX? It all just depends on the state that you live in. Thank you. It says people have told me I'm not a real nurse because I'm an LVN. I was offended. Let me tell you something right now. You had to get into that. Who is this? That's Amanda Burns. Ma'am, let me tell you something right now. You had to do the prereqs, or you had to get into the school. You had to apply, right? You still had to pass. You still had to do the clinicals. You still had to go get you have a license, do you not? Does it say licensed vocational nurse? Tell people stop fucking playing with you. I don't like that shit. Like, the thing about it is, like, when you start to go above your scope, and you start to think that you're better than everybody as an LVN, when you're talking, it, like, once again, it's always a fucking contest. Like, it's not a contest. We all play our pivotal role. You know what I'm saying? That's what we do. And so when people are just like, you're not a real nurse, bro, I'm gonna need for you to fucking go and look at my fucking license number, because it definitely says that. It says licensed vocational nurse or licensed practical nurse, whatever state that you're in, right? And I'm telling you right now, I've had people do that. They're like, not even a real nurse. I'm like, hey, I'm gonna need for you to check your mouth and check it at the door. Don't disrespect people like that. You still had to work hard and go through school for that. You know what I mean? So I graduate next month. I know that's right. I just got accepted into my RN program, nights and weekends. I'm less overwhelmed listening to you. Hey, Amber, I'm just letting you know, if you're gonna go to nights and go to weekends, when you're ready to get off nights and weekends, you need to open up your mouth, because working nights really can put a damper on you. And at least for me, that's why I say, at least for me, from my experience, I couldn't do nights after like almost a year. I was just like, I can't do this shit no more. Like, I need to get back on my regular scheduled program of not, being a night owl. It just wasn't really my thing. LPN to RN, what's the struggle to bridge? There is no struggle. Just apply for it. Currently on orientation in the NICU. The ER is the best. That is subjective, but hey, the ER's work. It does go down in the ER, right? Any advice? Graduating December and got a job in the ER. So here's another thing I'll tell you guys too, is that the moment that you guys get into where you guys are going, get a fucking mentor. Get a mentor. If your preceptor is good, stick with them, like at the hip, as much as you possibly can. Stick with them, right? Learn everything that you can from them, the good, the bad, the ugly, so you know how to navigate through your perspective area, okay? That right there can make or break a nurse. I went through 9 preceptors, y'all. Nine, right? And it's not German for no. I mean 9 for the number 9, right? And luckily for me, I found 2 of them that were absolutely wonderful. And they're both nurse practitioners now. One's been a pulmonary nurse practitioner, and one is a cardiac nurse practitioner, and they're both fucking wonderful. All right? Find a mentor. Hey, thank you for all the info. Do you have any good schools in California for LVN program? I don't know any in California. Agree. Whoa. That's a great journey. BSN, shout out to you. Love you. I love you. I'm definitely going to keep up with you. I appreciate it. I appreciate you being here. Thank you. Amber Richardson. Exactly. I got a 3.5. Is a 3.5 GPA good to apply? Go. Apply. How about you apply? Just apply. Doesn't matter what your GPA is. Just fucking apply, right? Just do it. LVN, LPN, RN, we are all, that's what I'm trying. Hey, it says nurse in it, doesn't it? The only one that doesn't necessarily include, because you don't have a license, is a CNA. And I'm not shitting on a CNA, but a CNA does not have a license, okay? Everyone, as I said, everybody has a pivotal role. RN since 96. Sharon, I think we talked about that before. No, I'm in the nights and weekend RN program. I won't be working nights. Okay, I got you. What age did you become an RN? Oh, man. I turned 36 this past Saturday. I want to say I was 32, 31, 30, something like that. I can't remember. One of those. Kristen says I got 2 E's. Like, do you recommend retaking? No, unless you need to. I'm refusing to work 12 hours. Give me 8s. Give me 8 and I will hit the gate. Have you ever heard of Achieve Prep? I think I have heard of Achieve Prep, but I've never used them. I'm from Arizona. Have not taken my NCLEX yet, but I am afraid of what is the limit for taking the exam. Eliza, once again, I'm going to tell you again, if you're scared, go to church. You need to get over that fear. That test ain't going nowhere. The longer you stay afraid, the longer you're not going to take it. But guess what? That test ain't going nowhere. And it all just depends on what state that you live in and how exactly like that'll go. All right. What if the preceptor is rude? If the preceptor is rude, you need to. Here's the thing. You need to tell them, like, hey, don't talk. Like, who is it? May. I'm going to really answer this question for you. If your preceptor is rude to you, you need to confront your preceptor at that point. You don't know what you don't know, and you're there to learn. The moment that they become an asshole or rude or try to eat you, like they try to eat their young shit, that's the moment that the instructor or student to teacher aspect of trying to retain information starts to go out the door. You're not even gonna fucking want to listen to anything that they have to say because they're rude to you. So you need to confront them. And then after you confront them, you need to go talk to either the charge nurse or the manager about getting you a different preceptor because it's not conducive for your learning. I'm telling you this because I'm an instructor. I've been an instructor from a court. Just because I was a surgical tech instructor, the learning aspect is the same. The only thing that's different is just nursing versus surgical tech. That's the only way. And if you can't do that, then you're going to be dealing with a rude preceptor or an asshole, and then you're just going to have to deal with that. And then you're going to hate going to work. You're going to hate learning. You're not going to learn anything from them, but do you have to have thick skin? Absolutely. You do have to have thick skin. I'm going to go inside because my phone's about to die and I still got a whole bunch of stuff that I got to answer. So hold on one sec. Ooh. Ooh. Hey, you guys want to see this dude? I'm going to show you. Look. Hey, say hi. Hey. Sir. Say hi. He's eating a Cheeto, y'all. He's eating a Cheeto. Obviously, he just does what he wants, right? He don't care about his daddy, right? So, hold on. Let us get this thing together. All right. Man, my phone's about to literally say, bro, you better get it together or I'm turning it off. All right, here we go. I'm gonna get it all set up. What do you mean, bro? Phone's about to die on me, y'all. Uh-oh, there it go. All right, here we go. Hey, if it dies on me, I'm sorry, y'all. I'm letting y'all know right now. I don't know what its problem is. Here we go. All right. I think we are good. I said I was going to get off a long time ago and y'all held me hostage and I don't like that. I don't like that at all. All right, let's see. I had 11 preceptors on my first job. That is terrible. Kevin, you need to write a book. It's already written. That's actually one of my many things to do in my life. So, hey man, he's handsome. I appreciate that. Little man cannot be bothered. I'm telling you, he's over there watching Blaze. And that is like his shit. So that's exactly what he's doing. It says, what a handsome little man. Thank you guys. I appreciate it. That's my little pride and joy over there. My little pride and joy. So, how do you feel about resident physicians? I actually had a crazy run-in with a resident physician a while back to where his bedside manner was really terrible. And he was lying to a patient's family who was a patient who was dying. And, I had to go in there and I had to correct him. So, it wasn't a good look. It wasn't a good look for him because then the senior resident and the chief was just like, why are you in there doing this, that, and the third? And I was just like, hey, bro, it's not my fault I had to check you because you're doing it wrong. So, but shout out to all 114 of y'all in here rocking with me, man. Like I said, my little man's in there doing this thing. If you guys are new here, my name is Kevin. Been a nurse for about a little over 3 years. Been in the Navy for 16 years. All that good jazz. Yeah. What question you guys? I want to know who you guys are, where you're from, where you're at in your nursing journey. I wasn't even gonna do this TikTok. I definitely didn't want it to be this long, but you guys are asking a tons of questions, so I want to know who you are, where you're from, where you're at in your nursing journey. What questions you guys have in regards to nursing, in regards to NCLEX. Make sure you guys follow. Like following and sharing and liking is like so important for the TikTok algorithm. Plot twist, I'm a resident. Oh, that ain't a plot twist. You still get this work, okay? I'm just playing. It says, hold on, let me see. It says, so how do you not be so blunt? I'm very outspoken. So the thing about it is like it's always all about articulating. It's always about how you can articulate your verbiage, right? So me, I'm not rude to people until they're rude to me. It's just like if I'm wrong, I will admit that I'm wrong. I'm like, look, I don't know that. I'm like, look, that was my bad. But some people, they don't know how to take the constructive criticism, and they don't know how to admit when they're wrong doing something. So what made you want to become a nurse? I was working as a surgical tech, and then I deployed on my second deployment as a surgical tech. And I realized that I got to do a lot of nursing things, and I wanted to expand my knowledge. And then I got to the point to where I wanted to be a physician, right? But then, because I wanted to do anesthesia, and that just didn't work out. I saw how doctors were treating patients, and I was just like, in my mind, I was just like, man, doctors really see patients as they see them as a number rather than see them as a people. And so if you don't understand that, like, doctors do medicine, nursing is patient care. So medicine people. Not saying that they don't take care, but it's just like that is the whole thing is patient oriented with nursing. And that's why I decided I wanted to become a nurse. And I don't regret being a nurse at all. But user A6 says plot twist, I'm a resident physician. But shout out to you, because people don't realize as residents, like, people think that doctors, even in residency, they get paid, and I'm telling you, they be working them to the bone, y'all, working them to the bone. I know it. I seen it. And I'm just like, they're just as stressed, if not more stressed than, resident, brand new nurses. So I get it. 35 years in the PCU. Shout out to you. I'm from Dallas, Texas. Been a nurse for a year and a half. Okay. Do you recommend taking the NCLEX right out of school or giving yourself time? Take it ASAP. Study for the T's and the HESI. Want to apply for my BSN program from Houston, Texas. Christian, we're going to change your verbiage. We're not going to say want to apply. You will apply. There's no wanting. You can want to do anything, but you doing it, actually doing it, putting those steps into play, that's what we want. All right. Thanks for your advice. See you next time. Lily, I appreciate you being here. Thank you. Going in the fall with RN. Let us pray. Okay. 8 months graduated. Trauma OR, level 1 trauma facility. Shout out to you, Laura. Nursing student from LA, third semester. Your tip on how to study for pediatrics. I always really, really recommend some really good YouTube channels. Of course, like Nexus Nurse is a good one. And of course, Simple Nursing is another one. What is it? Level Up Nursing is a really good one as well. Osmosis is a good one. There's tons of them out there. How would you recommend going about getting a job at a hospital? I've applied for 6 hospitals and nothing. Jasmine, doctors see money. They do see money. However, a resident physician, they don't make a lot of money. So to get a first job, are you a brand new nurse, Jasmine? I agree. I was thinking about this today in the shower. That's crazy. Oh, okay. Nurses are special people. They really are. My dad wanted me to be a physician. My hourly wage do be minimum. Look, so I have a couple of surgeons that are in residency right now, and they probably made like as much. They were only making like anywhere between like $50,000 a year. Believe it or not. In residency, they don't make a lot of money. It's just when they get out of residency, that's when they start making the money, right? It says, thank you for this information, Kevin. God bless you. I appreciate it. Thank you for being here. Hey, I'm in Maryland in med-surg, endocrine. Okay. Will apply. Thank you. I know that's right. I'm from NY, and I'm taking NCLEX for the second time. Still waiting for my results. All right, Maria. Well, let us know what your results are. In nursing school right now. Okay, testing on catheter tomorrow. Wish me luck. You don't need luck because you already know how to do it. And if you don't know how to do it, I would suggest going back over the book and reapplying those skills in the lab and all the other good jazz, okay? I'm thinking about becoming a scrub nurse. What's it like to work as a scrub nurse? You work in the OR, you get to scrub, you get to, help set up the back table, but most of the time you just get to assume and help the physician up. And I love it. I liked it. I've been doing it for so long. I'm just like, it is what it is. But, it is very much a thing that you can do. And I would highly recommend it. You can actually become a surgical nurse practitioner. Did you guys know that? Did you guys know that you guys could go that route? By being a scrub, you can go be a circulating nurse and then be a scrub nurse and then get a certification to being an RNFA or so a registered nurse first assist. And then, you can go to MP school, specialize in surgery and be a surgical nurse practitioner working with a physician. So did you guys know that? If you don't, you do now. So no, I'm an LPN for 4 years. I've been an RN for 1 year. Oh, okay. I got you. 2 years RN and I still feel brand new. It happens. It happens. Need help getting through med surge. You got to get into a study group. I love being an RN. I didn't know that. Yeah, you didn't know that. That's cool. Yeah, it really is kind of cool, right? So those are some things that you guys can really think about. I use Simple Nursing for med-surg. So I said there's a ton of YouTube. I will always recommend people doing YouTube because there's so many free things out there that you guys can use. However, there are other ones that, can really hone things in from, from point A to point B or from A to B, streamlining it, which is why, I essentially created, the 7-day NCLEX course. And to reiterate what that is, usually when you guys do NCLEX reviews for people that are due it, they cram all this information into you in 3 days, like over a weekend, like a Saturday or Sunday or a Friday, Saturday and Sunday or whatever. I decided to spread it out over 7 days because what that does, it allows for you to have 2 to 3 hours out of your day or even less than that to getting the need to know information, pondering on it, letting it marinate, and then coming back to another section the next day and going over those different sections that are really important that the NCLEX wants you to know. Management of care, pharmacology. What's up, Dave? Management, pharmacology, physiological adaptation, reduction in risk potential, psychosocial integrity, health promotions and maintenance, basic care and comfort, all those good stuff. So that's why I decided to create it like that. But it's in its pre-launch phase right now, which is why it is the price that it is. So if you don't want it, cool. You never know. Share it with somebody else. They may need it, right? And the price is going to go up. I'm just letting you guys know that right now. It's going to go up. And here's another thing. If you've been unsuccessful at the exam or if you want extra help with the exam, I do that as well. So you guys can go over there and check that out as well. All those links are in my bio and my link tree. You guys can go over there and check those out. So man, we've been over here for 90 minutes and I've been over here talking to y'all. So I appreciate everybody for, wanting to hang around and rock with me. So what else you guys got? The hospitals don't take your LPN experience into consideration. So as an LPN, they do not take your consideration into effect as an RN because they're going to be like, okay, you worked 20 years as an LPN, but you never worked 20 years or, that 20 years, it can help when it comes to knowing like the unit, if you've worked on that unit for a long time, but the actual experience of working with more increased responsibility as an RN, nah, they don't take it into consideration. They don't. It could help you definitely get a job though. It can definitely help you get the job by having the experience, especially if you've built the rapport on that floor. Okay. But man, I appreciate everybody being here and rocking with me. Today is Wednesday, so we'll be doing NCLEX questions on Friday. Same time, 5:30 Central Standard Time. So shout out to everybody that's in Texas or Central Standard Time or whatever. Hey, don't forget on the 5th of November, our time, clocks are going back unless you're Mountain Time and then you're stuck. So it says, what about international nurses? Where from start for the RN exam? So if you're an international nurse, it all just depends on what country you come from. Because I know like in the Philippines, they require you to work there for at least like 2 years because they have their own licensing exam. And then you can come over to the United States and then do the NCLEX like that way. So if you're an international nurse, you have to apply at the state's board of nursing to which you want to go work. And then they'll tell you, hey, we accept it or you don't, or we accept it or we don't. And then they may require you to take the NCLEX here in the United States. Ethiopia, okay. So yeah, so essentially it would be the same thing. You would have to apply here in the United States. And then they will tell you whether or not it is good to go or not. And I can tell you most places when you come from outside of the United States, they're gonna want you to take they're gonna make you take the NCLEX. So they're gonna make you take that exam. So be aware of that. Arlene says, just started what? Did I just start this live? No, I've been on here for an hour and a half. We didn't do any questions today, but we did. I answered a ton of questions for everybody, tons of questions. So what other questions do you guys have? I know. Hey, but Jay, just so you know that all these lives that I do, they go up on YouTube. So if you missed anything, you guys can always go to my YouTube channel, which is in my link in my bio, and you guys can go and check that out. Okay. It says, yes, your experience transfers to, especially from the Philippines. Yep. They actually have, your experience will transfer from being there. The only thing that you need to do is you have to take that exam once you leave the Philippines and you come to the United States. So Africa, I think, is a little bit different. Africa is just a little bit different. So is it Mira? Is it Mira? Did I say it right? Thank you for fact checking me, because if I'm saying something wrong, please correct me. I have no problem with constructive criticism, or if I'm saying something wrong, because I don't know. I know a lot of things, but I don't know everything. Okay. Nope. It is not different. Okay, cool. That's good to know. Do you recommend starting as an LPN or going straight to RN when you have zero nursing background? It all just depends on you. It depends on what your pockets look like. Do you want to go the LPN route so you can get into the nursing, the nursing field faster and start making money? Or do you want to go RN? It all just depends on you. Some people go and be LPNs and they love it and they don't ever want to do RN. Some people want to go straight. And here's the thing, you don't have to have experience. I know girls that were in my BSN program that were photographers. You know what I mean? So it all just depends on you. You're welcome. Is it Mule? I hope I said that right. So you're welcome. It says, taking my NCLEX taking my NCLEX at the end of this month, I purchased your program. I think I did see your name pop up there. I think it was from this morning. Well, ma'am, hopefully these content videos will work out very well for you. I'm putting a review in there sometime this week. So yeah, that's wonderful. So that's wonderful. That makes me happy when I have people jump in here that tell me that they got the program. I'm always ready for the constructive criticism on how to make everything grow. Fighting for my life this semester. Judy, I bet you are. I bet you're getting humbled your first semester, huh? Or if this is your first semester or wherever you are in your nursing journey. I am South African. Okay, King. Okay. I don't know nothing about South Africa, right? What part of South Africa? Give us some, give us some little tidbits about where you're from. What is the hardest part of nursing? That's a very generalized statement. Are you talking about nursing school? Are you talking about the nursing profession? Are you talking about nursing areas? It like every aspect. Look, you can't say both because there's so many different aspects of nursing that I could talk about. The hardest part of nursing is, in one of my opinions, is getting through imposter syndrome. That's one of the hardest part of nursing, is feeling like even though you got the skill or you got the knowledge to be there, you still feel like you don't belong there. And school is hard. School is most definitely hard. Working is hard as well. Starting an 80-year program in 24. Shout out to you, Taurus. Are you a Taurus? Because look, I'm a Scorpio and me and Taurus really don't get along like that. You know what I'm saying? So there's that. Judy. Oh yeah, Judy. I bet you're getting humble that first semester. But you want to know something about the first semester of nursing school? That is what we call like the weed out, right? You weed people out that don't belong there, right? Usually, if you can get through your first 2 semesters of nursing school, you'll be able to make it. You'll get through it. You're a Taurus, Lord of mercy. Oh my God. Oh my God. It says, what do you do now? What do I do now as a nurse? I work as an OR nurse, but currently right now I'm at home, I'm on short-term disability because I got hurt at work. So my prereqs have already humbled me. I believe it. So prereqs will do that to you, but your first semester in nursing school will really do it to you because you're going to get bombarded with so much information. And time management has to be your best friend when you are in nursing school, ladies and gentlemen. Okay. It has to be your best friend. You got to cut people off. I'm gonna tell you something right now. You think you got friends, you will really know who your real friends are when you start nursing school. And you will know who the real people are in your life when you finish nursing school. All right. You're going to lose people. Trust and believe me. What do you think about PICU nurse? I think it's cool. The pediatric ICU, if that's where you want to go, cool. How often do you renew licensing as a nurse? In Texas, it's every 2 years. And I believe it's like that every state, I believe. Started with 60 and only 14 graduate. Look, ain't that something? I'm telling you, it ain't a game. It ain't a game. You have to live, eat, breathe nursing while you're in nursing school. That is what your whole life is about. It says, I'm stuck between sonography and LPN RN. I read that sonography is harder. So here's the thing. If you're looking for an easy way out, it ain't for you. There's a reason why nursing school is difficult to get into. There's a reason why the NCLEX is hard. And there's a reason why. There's a reason why those things are hard. It's to keep people out. Because if you're not willing to put in the work to do it, they don't want you there. And that's the facts. That's the truth. Like some people are just like, man, fuck that school, fuck this test. No, well, maybe it's just fuck you. Sorry, I'm just being completely honest. Those things are put into place to keep people out, right? So if you think it's hard, that's because it is. So it just depends on where you, this is for user 7-8, it just depends on where you want to go, what your passion is, and what you want to do. Of course it's going to be hard. It's not meant to be easy, right? I only had one friend outside of nursing school by the time I was, that's Laura, I'm trying to tell you. You already know the deal, and you've been working as a nurse, you said, for 8 months already, so you already know what's up. So true. They kicked so many people out of my nursing class, and they will. We started with 30 and 60 in my cohort, and we were at like 26 or something like that. Sorry if you guys hear my son in there. He's over there being a turd. I don't know what his problem is. I think his mom took his Cheetos away. I don't know what's up. But but yeah, like I said, user 78. There ain't no shade on you. And I understand, hey, you're torn, you're stuck between those. You just need to figure out what you want to do, regardless if it's hard or not. Okay. It says join through an invite. Chevy Bless Lewis. Oh, okay. You got through an invite. Okay, girl. Appreciate you being here. I'm gonna hang out for about another 5-6 minutes. So what y'all got? What other question you guys got? Hey, if you guys new here, like I said, we're doing an Ask Me Anything. This is in regards to nursing. NCLEX, nursing, your first year of nursing, whatever. I want to know who you are, where you're from, where you're at in your nursing journey. And even if you're not a nurse, like, what do you do? Like, what do you want to do? What are you doing? I've had some RTs in here. I had a nurse, a resident physician up in here, cracking jokes. Had some RTs, some patient care techs, CNAs, all that good jazz. Make sure you guys like, share, and follow. That is the important thing, because that's what helps the TikTok algorithm, right? What you use to study, resources you use. Okay, I'm going for you to give me a little bit more context than that. You got to give me a little bit more context. Johnny X says, hi, I'm a nursing student. Shout out to you, Johnny. Shout out for you for being here. So got some nursing students. We got nurses that have been nurses for a couple of months, a year, 2 years, so on and so forth. How do you stand up to surgeons in the OR? I have a hard time sometimes with pushback. So here's the thing, is that if you know that you're wrong, you know that you're wrong, right? However, you honestly just have to tell them. It says, have a good night. I love coming to see your lives. Maria, I love you being here. I appreciate you. You have a good night as well. The one thing that you have to do to stand up is that you have to surgeons get this God complex shit. And I don't know what's up with that. They get this God complex shit. So you got to just be like, hey, I'm here to help you. Don't talk to me like that. You just got to let them know, like, hey, don't talk to me like that. You know what I'm saying? Like, I've had it to where I had a surgeon was just like, hey, can you do he was already nasty, and he was just like, hey, you need to do this. And I'm just like, are you asking me or are you telling me? And he was just like, I'm telling you. I was like, how about you ask me? I was like, because we're all on the same team here. Right. And so he didn't like that at all. And then he told my director, he was like, what's this issue? I was like, oh, no, there was no issue. I didn't have no issue. He had an issue. His problem ain't my problem. I was like, I helped and do what I'm supposed to do. Right. But if you talk to me like I'm not a person and I'm like your slave, but we're probably not a really good word, but like we're doing a teamwork, we're a team, then we got a problem. And I'm going to check you. I'm going to check you hard. Like, don't talk to me like that. Like, I'm not your son. I'm not your wife. I'm not your husband. Like, don't talk to me like you're crazy. Now, if I'm wrong, I'll be like, hey, look, that was my bad. Because I've been there. I'll be like, look, that's my bad. I did that. I'll take that L. But if you talk to me like you're crazy, you're going to get a response. You're going to get a crazy response. It said, so that's what I did. Laura, but you will figure out a way to navigate through that. Okay. Hi, in 6 days, I start school to be a CNA. I know it's not like being an RN or an LPN, but I am super nervous. Any advice? Nelly, how can I give you the best advice possible? Just be a sponge. You got to be a sponge, right? Even though you're not an RN or an LPN, you still are an intricate part of the team, and never let anybody think that you aren't. Okay. So the biggest thing that you got to be a sponge. Time management is very, very important for you as well. You got time management. It said Nisma, it says, do you know anyone who is in an accelerated BSN program, just starting and looking for some advice? I was in an accelerated BSN program, and time management for you as well. Time management for you as well. That's the biggest thing I can say. Hey, Ma'am, who is that? Is that Yari? How are you, ma'am? Thank you for the roses. Laura, you are welcome. I have a bachelor's degree in health management, 4 prerequisite classes, 2 to go before nursing program. Shout out to you, Miss Chevy. What do you think about PACU? I love the PACU. I tell anybody to go to the PACU. PACU, in my opinion, one of the holy grails of nursing. One of the holy grails. Hello, I'm looking for a great LPN to BSN program. Western Governors University. Is that for Gigi? Western Governors University is one I could definitely recommend. Starting my prerequisites soon. Any advice for the T's? So, Yari, I would recommend looking at it's a yellow Mometrics book. Gigi, you're welcome. But a yellow Mometrics book that you could get off of Amazon for the T's exam, to the entrance exam. It's a yellow Mometrics book. It's like $33 on Amazon. That's a good T's book, as well as they have one for HESI as well, if you were going that. Do you think it's good for a new nurse to work in the PACU? If you're a new nurse, you can go wherever you want. Like, stop letting... I don't care what your professor say. And if I was your instructor, I tell you to go wherever the hell you want, right? Go to where you want. Ma'am, you are very welcome. Is that Yari? You're very welcome. Yari, am I saying that right? Is it Yari, or is it spelled differently, or is it said differently, or whatever? But yeah, you can go wherever you want. Any advice on the exit HESI and study tips? Some really good, So for HESI, I know they use Evolve or Elsevier. Honestly, that's where they're getting their questions from, and I would definitely use those. So those Saunders book, all that stuff. That's what I would definitely recommend. Is it Timberly? That is different. I've never heard somebody's name Timberly. It's like Kimberly, but with a T. Shout out to your parents for naming you that. So, who is that? Is that Nami or Nani and Lachey? Thank you for the follow. I appreciate you. But all right, y'all. I think we had a really good turnout today. Timberly, yes. Okay. All right, cool. I got you, Timberly. You better be following and you better share. You better be liking and following, ma'am. Okay. Because that's what we about. You better follow me right now. Rolls the eyes, but yes, it's correct. Oh, my bad. Sorry, Yari. But yeah, it says a racist instructor failed me. Clinicals. I would have had 1 semester to go. Nina. I don't even know how to even necessarily respond to that, because unfortunately you do have people that are out there like that. What's up, Rachel? How are you? Do you offer tutoring on prerequisite courses? Chevy, unfortunately, I do not. I really only do NCLEX, like NCLEX prep. That's what I do. That's unfortunate that you had that happen, Nina. And I can't say that it's a lie, because I've seen it happen. And I've even seen them discriminate against men. Like some women, most nursing is 89% women, right? And I've seen them discriminate to be like, oh, I don't like him because he thinks he's this and he thinks he's that. And I've seen them do it, right? And that's unfortunate that you had that. It's okay. Bombed my last exam, though. What you mean, Rachel? Rachel, you bombed it. I'm sorry that you bombed it. Well, what are we going to do to fix it? You already know what to do. Cass is here, y'all. Oh, man. Cass is here. But here's the one thing. Are you still in school? That's the thing, Nina. Are you still in school? Don't let someone's opinion of you dictate who you are and what type of nurse that you're going to become. They failed you. Fuck it. It's behind you, right? You're still in school, right? The biggest middle finger that you could give to that individual that did that to you is getting that fucking degree and then being like, check me out. Check me out. Like my James Harden, where I look at the camera and you see what I'm saying? Do that. I'm going to repeat the same course. Do that. All right? That's the way to do it. The biggest middle finger you could give to anybody that's really trying to fuck up your journey is to achieve what you set yourself out to achieve. I have to update my evidence of practice and racist nurse failed me. Same thing goes for you. Don't let those motherfuckers gatekeep the nursing professional from you because they want to be racist. You know what I'm saying? Don't let them gatekeep you from that, right? Because it's a power trip. It's a power complex. Yes, I had an instructor fail my friend because she didn't like the color of her hair. Ain't that some shit? Everybody wants to follow the rules until it's inconvenient for them. I think I said that right. Right? So I want to fail her because of the color of her hair, right? That's what Desiree just said, right? But I bet you if somebody else had different color hair and she was like, oh my God, I like her because of X, Y, and Z. You know what I mean? And see, now that's a problem. If you're out here failing us, and if you're out here failing 17 people that are the same thing, why are people coming in here saying free Palestine? I mean, I get it, but I got you, bro. I got you. I don't know. Are we talking about nursing stuff? Because I know we have Palestinian nurses that come up in here too. So, but it says MCAT in 2 months. Pray for me, Brad. You got it. It says, how long have you been a nurse? I've been a nurse for 3 years. As a new nurse, you can choose, but pick a facility that offers training. Yes, you want training. I'm telling you right now, you want the training. All right. You want the training. I mean, being a nurse is an occupation. So yes, Jessica, you're very much correct. You're very much seeing this thing correctly, Jessica. So, but shout out to everybody that's up in here. I said I was going to leave, but I'm still here. I'm still here answering y'all's questions. All right. How do you convince the board that I'm not lacking skills? It's the racist nurses. So just like so here's the thing is it's all about a power complex. It's all about control. They feel like they have control. So the thing about it is just like you have to present to them what they want. And that's the unfortunate thing. Any advice for NCLEX, study for it. I don't mean to be like an asshole and say that, but yeah, you got to study for it. I don't know exactly what you're lacking in, but the advice I would tell you is recreate the testing center, understand NCLEX style questions, understand content, get yourself a really good review. I have a review, 7-day NCLEX course. Check it out in my bio. Also, you got to practice like you play. I love the hospital I started in. It's minimum 12-week training and extended to 16 weeks. I'm telling you right now, and not ICUs, but trainings need to be extended. They don't need to be these 10 weeks, 12 weeks, 6 weeks, whatever that BS is. They don't need to be that way. Any resources for case studies that you can recommend? What do you mean, Rachel? Give me a little bit more context. Doctors and nurses and CNAs and everyone in healthcare getting along is what the world needs. Facts, Brad. You are 100%. And you said you're studying for your MCAT and you're going to go be a doctor. I think that's what you said. Hey, yeah, get you a lawyer. If you get you a lawyer and watch them fall all up in litigation and they're going to be like, oh, no, it wasn't like that. And also you can get the board of nursing involved, too. Do that. Get your state's board of nursing involved when it comes to racial discrimination. Do that. And watch how fast they'll clean up their act. But this is going back to Brad. Brad, if you're going to be a doctor, here's something I really, really want you to understand. I really want you to never forget where you come from and always be willing to teach everybody. Always be willing to teach everybody. So it takes me a little longer to process case studies, info, especially during clinicals. Want to practice. You know what's a really good, honestly, the National Counsel State Boards of Nursing, you can find case studies. They have practice case studies on that website when you're studying for NCLEX. They fired the racist nurse after I got a lawyer. Look at that. How do you get an appeal accepted after academic failing? So that's a good question. I've never been LaTanya. I've never been in that situation. Now, with an academic appeal, you have to be able to prove to them that you have to be able to prove to them that you're going to be able to succeed in the program. You have to be able to do that. But then again, it's just like, okay, if I'm on an academic appeal, then you have to bring to them. So there's a problem, but so you have to bring to them a solution on how you are going to be able to progress through this program, right? That's what they want. They want to be able to see that you're going to be successful, because if not, they're going to drop you, or they're going to be like, hey, try again next year. National Nursing what? The National Council of State Boards of Nursing, so the NCSBN, the people that write the NCLEX exam, they have practice case studies over there. Rachel, procedure for CNA, I don't know what that means. What does that mean? Is it Susmita? Susmita, what does that mean? What does that mean, Susmita? Procedure for CNA. You're welcome, Rachel. I went through the process due to divorce in nursing school. Yep. And it'll happen. And a lot of times the boards, none of times the boards, you got to think it's just like a lot of those people don't know you, but then you'll have your instructors that are in there that'll fight for you as well. But that's why you have to be very open, like, hey, this is what I have going on, so on and so forth. And then a lot of times they'll be like, well, what do you want to do? Do you want to drop out or do you this or do you that? If you know that you can make it through, keep pushing. If you can't, then stop wasting your time and your money and then try again. Those things are possible. So not being able to go into second semester will require a spot for next year. Okay. I feel like getting help from instructors is a double-edged sword. Yes, they want to help, but they also judge. Fuck them. Who cares if they judge? Your opinion of me has nothing to do with me. It says nothing about my work ethic. It says nothing. However, when you're in school, you're at the mercy of them. And that's the crazy part. That's the crazy part about the whole fucking thing. All right. Not being able to go into second semester will require a spot for next year. So essentially they're saying that if you don't get it, you would have to go into the next spot. Okay. My success is based on their perception of my success though. And I agree. And I don't disagree with you. I don't disagree with you. Because remember, all they see is who you are on paper. That's it. And so their perception of oh, she's a good student, but they don't know what you do outside of that. Right. So you have to essentially go in there and kind of, remember, it's kind of like being in a good old boys club. Who is the best person that could be in the club with me? So give them what they want. So Rachel, I don't disagree with you. I don't disagree with you at all. What else you guys got? As a matter of fact, I think I'm good. I think we're good on the questions for tonight. We were up in here for almost 2.5 hours. Almost 2.5 hours. Let them judge. You have to advocate for your measure. That's right. Let them know, Banana. Let them know. But once again, I'm going to hop up off here. I appreciate everybody who came through. Hey, we're going to be doing this same thing. We're going to be doing this same thing on Friday. Yeah, you can email me. My email, it should be in my link in my bio. Also, once again, 7-day NCLEX course, y'all. It's in its pre-launch phase. We have 42 videos going up there, and the NCLEX review is going up sometime this week. 100 questions with some tips, how to break questions down and reading rationales for $48, y'all. And it's going up. So I'm trying to tell you, hey, buy it as a Christmas gift for somebody. Buy it as a Christmas gift. I'm just saying. Buy it. Can you help with studying? I also do one-on-one tutoring and coaching for NCLEX. That link is also in my bio. You can check that out. Looking forward to supporting you when that time comes. Rachel, I love to hear it. I love to hear it. So, like I said, make sure you guys go over there and check out those links. We're going to be doing some stuff on Friday, so I hope everybody's here for that as well. But until then, hopefully everybody has a really good rest of their week, and I will see everybody on Friday. So until then, bye.